it's Heather from the ER. Can I call a report on room 605?
Yeah, hold on, wait. Who's taking a report from the ER on 605?
Oh, is that the ER again?
Yep,
Yeah, that's me. Hey, I gotta go.
hang on. There you go.
I see you, Sue.
Hey, it's Heather from the ER calling a report on 605.
Yep. Hey, what's beeping back there? Can somebody please shut that off? Okay, now where were we?
Okay, what's your name again?
Sue.
Thanks, mine's Heather. All right, this is John going to 605, 67-year-old male who is being admitted to Dr. Achu
God bless you.
with pneumonia. So he came in via EMS from Cambria Care with a change in mental status. He had a period of apnea reported by EMS. I'm not sure if it was at the nursing home or in the ambulance. But anyhow, when he first got here, his vitals were 72/50, respiratory rate 25, pulse ox 88 on room air. He was really out of it, cold and clammy, and a lot of secretions. It was only responsive to pain. We had a lot of trouble with the airway, so we intubated him. Also did an AccuCheck. It was low at 49, so we gave him an amp of D50. Had trouble getting the line too, go figure. So ended up putting in a central line. Needed fluid, so we gave 2 liters. Couldn't get an NG tube in either. Has a Foley draining clear, dark yellow urine. Probably has a UTI as well.
Oh, does he have a history of UTIs?
Do you have the patient up in Epic?
Yeah, no, he's not gonna be my patient. His nurse is busy.
Hey, Sue,
So I thought I would just take
let's get off the
report.
phone. Do you think you could get that urine at 602? I'm headed to lunch.
Yeah, I can do that.
Well then, labs and medical history are all on the chart. Have whoever look at those before we bring the patient up. And if there are any questions, they can get back to me. Okay, great. Okay, let me finish report. It's going to get really busy down here.
Well, hopefully those traumas won't be coming here.
Okay, meds. We gave Levofed 1.5 mics per kilogram per minute, Vanco and Zosyn given. He's allergic to morphine.
What's his weight?
I think they told us from the nursing home that it's 65 kgs. Any other questions?
Nope.
Okay, then we'll call before we bring him up.
Okay.
All right, thanks. Goodbye.
ICU, this is Sue.
Hi, Sue. I report on room 605 when you're ready.
Okay, hang on a second here. Let me log into the computer. Hold on for 1 second. Okay, I'm ready.
No problem. I'm calling to report on John. I've been septic, going to room 605 for Dr. Achu. Can you pull him up on your screen, please?
Let me see here. Yeah, there he is. John, I've been septic, correct? Date of birth, February 2nd, 1950, for Dr. Achu.
Yes, that's correct.
Okay, go ahead.
Okay, Sue. Sorry, I don't think I said you my name. This is Heather from the ER. I'm calling to report on room 605, John Ivan Septic, being admitted for Dr. Achu. He is a 67-year-old male who presented to the ER at 11 o'clock this morning via EMS from Cambria Care Center with a mental status change. Upon his arrival, EMS stated that he had an apneic period pre-hospital. Initial assessment revealed he was unresponsive, cool clammy skin, copious amounts of secretions, vitals, heart rate 68, respiratory rate 25, BP 72/50, and a pulse ox on room air at 88%. No initial temperature was obtained, and we immediately intubated him at bedside for airway protection with his mental status change and low pulse ox. It was a 7.5 ET tube placed at 22 cms at the lips. We did place a Foley. Urine production is dark, cloudy urine with 2+ bacteria. IV Zosyn was given, and IV Vanco is currently running. He does have a history of UTIs. His labs returned with, WBC of 16.8, creatinine 2.8, lactic acid 2.5, in which we gave 30 cc's per kilogram of fluid, which was given for that and the blood pressure. Troponin came back elevated as well, 1.36. BNP 1849. He does have a history of CHF. His initial AccuCheck was 49, and we did give him an AMP of D50. We did not recheck an AccuCheck on him as of yet. He has a central line, which we placed. He has Levofed going for his blood pressure. It's at the rate of 1.5 mics per kilogram per minute. We did obtain an actual weight, which is 65 kgs. And right now, his initial diagnosis is a UTI, change in mental status, dehydration, hypoglycemia, and possible pneumonia. Right now, vitals are temp of 101, heart rate 70, respiratory rate 24, BP 108/60, and his sats are 90%. He is a full code. He is tolerating the vent settings and IV medications. He is sedated and resting comfortably. He is allergic to morphine. We did the C. diff screening, and he's negative for C. diff. His lab values to watch are that white count of 16.8, creatinine 2.8, lactic acid 2.5, AccuCheck 49, and he is a fall risk, of course. With that lactic acid greater than 2, he's going to need a repeat drawn within 4 hours, and we'll need to monitor his AccuChecks. The next dose of antibiotics is due at 2300. Patient's going to have a CT of the chest on the way to the floor. We'll call you when we leave CAT scan. Do you have any other questions for me at this time?
Yeah, I do have some questions. So the lactic acid is greater than 2, and I need to make sure that we have a repeat ordered within 4 hours. Is that correct?
Yes, we drew the original this morning at 11:30 this morning.
Okay, and you have not yet done that repeat AccuCheck. Since the D50 was giving, are you going to do that down there, or should we do one as soon as we get to the floor?
I'll grab another AccuCheck and give the results to you when we arrive on the floor.
That would be great. I just heard that trauma alert, and I know you have to run, but I do have 2 additional questions. You said fluids were given, and I may have missed what you said, but what solution did you give?
We ran normal saline.
Okay, normal saline given, and the patient has a history of CHF, and there's any signs that the fluid was affecting the patient?
No, he's tolerating fluids well. Any other questions for me?
No, I don't think so. Thanks so much.
Okay, no problem. I'll give you an updated report at bedside. Thank you.
Yeah.
Dr. Chu? Hi, this is Dr. Payne. I'm calling you for the admission of a 67-year-old male with sepsis due to pneumonia and UTI. The patient presented from a skilled nursing facility with altered mental status and apnea. On arrival, he was intubated due to copious secretions, hypoxia of 88% of room air, and airway protection. He was also hypotensive with a pressure of 72/50, therefore a central line was placed. He was given 2 liters of fluid while he was here and started on Levofed at 1.5 mics per kg per minute.
Sounds like it's getting pretty busy down there.
Yeah, everything has to be alert now, so we'll see what this really is coming in for. Heather, by the way, why is it coming in? Okay, where was I? Well, better wrap this up. Lab showed white count of 17, lactic acid of 2.5, UA of 2+ bacteria. We gave him Zosyn and vancomycin. He also has AKI, creatinine of 2.8. Troponin was also elevated at 1.36, and a BNP of 1849. Glucose was 49, so we gave him an AMP of D50. Any questions? All right, good. Good nurses will bring him down very shortly. Thanks.
ICU, Dr. Chu.
Dr. Chu, this is Dr. Payne in the ER. I'm calling to hand off a patient, a 67-year-old white male, date of birth February 2nd, 1950, Mr. John Ibn Septic. He presented to the ED this morning at around 11 o'clock from EMS. The patient was transferred from a nursing home due to complaints of cough and dyspnea. On presentation, vitals showed a temperature of 39 degrees, a blood pressure of 70/50, and a heart rate of 110, and respirations of 35. Oxygen saturation were 85% on 100% non-rebreather. On physical exam, he was unresponsive, poor respiratory effort, and bilateral bronchi. Initial evaluation demonstrated bilateral infiltrates, a white count of 17,000, lactic acid of 2.5. ABG showed a pH of 7.28, PCO2 of 58, PO2 of 65. The patient is with septic shock due to pneumonia and associated respiratory failure.
All right, so what have you done for him so far down there?
We verified that he's a full code. Blood cultures were obtained with initial labs. The patient was intubated emergently. He received 30 cc's per kilograms of fluid bolus of normal saline, IV vancomycin and zosyn in blood cultures. When he remained hypotensive after the fluids, we started him on Levofed. On the ventilator, at 100% FiO2, his saturations are running in the low 90s. With pressures, his pressure right now is 90/50.
All right, so we have a patient with pneumonia, septic shock, and respiratory failure. You've cultured him. He's on antibiotics and the ventilator with pressors.
Yes, that is correct. Here's a few of the things you should know. He's a diabetic with coronary disease. His blood sugar was only 41. He received an amplitude 50 and blood sugar is now 101. Troponin is 2.5 and EKG demonstrates sinus tachycardia with some non-specific changes. He is allergic to morphine. We need to follow up on blood sugar, lactic acid, and cardiac ABGs once he's in the ICU. He follow up, lactic acid is already ordered for the protocol, but she'll need to take a look at that.
Okay, I'll make sure he gets that follow-up blood sugar in the ABG when he arrives, and I'll review that repeat lactic acid.
They're getting the patient ready for transport now. Family is also on the way. We'll direct them to the ICU if they arrive here. Let me know if you have any questions.
Oh, okay, thanks, I will. Good luck with those traumas coming in. Bye.